We're going to tackle chapter 4, which is really short, but we're also going to talk about counseling online, which is what we're going to be doing, and that's how you're going to fulfill your requirements. Counseling online, of course, is something that was not that common before the pandemic, and since the pandemic, it has become the major way of doing counseling. Um, it has become extremely important. So, one of the things that we need to talk about is the fact that all the people in this class, if you plan to pass the class, need to do some practice counseling. And the way we're going to do that is by cell phone, by email, by Duo, Zoom. There's a face type of Facebook where you can talk back and forth. Um, Skype is another one. Okay, so that's how we're going to do it. So you need to start communicating with your fellow classmates. I think there are, wait a minute, 20 of you. So that's 20 people that you can possibly counsel. You need to create a character. The character that you create cannot have a problem that you've had in the past, and the character cannot have a problem that you're close to. Um, and the way we're going to learn about our character's problem, the way that you need to do this, is that you're going to write a paper about whatever that problem is, and it can be anything. It doesn't really matter. There are no problems that are off limits because the reality is there are no problems that are off limits, no matter what they are. It could have something to do with transgender, adjusting to a new sexual orientation, to a new concept of a person's sexuality. It can be anxiety, it can be depression, it can be substance abuse, schizophrenia, bipolar disorder. You could have some kind of strange fetish, hoarding. One of my students was a hoarder. Wasn't a hoarder, but their character was a hoarder. You need to give them a fictitious name, of course. And so anyway, that's what we need. That's what you need to do, and that's how you can pass the class. So let's go ahead. And I will be continually telling you about this. Once you finish your character history, and it's on the assignments page, is a copy of the client history for your character. Fill that out and send it to me, and email it to me, and I will put it on the discussion page and give you 50 points credit. So let's go ahead and get started. Today we're going to talk about professionalism and professional relationships. If I can get this thing going, there we go. Okay. A professional is a person who has specialized training for a particular career and who acts in conscientious, appropriate ways in the workplace. Being a professional involves conducting yourself in an appropriate manner, dressing appropriately, being organized, timely, and accurately, recording meetings with colleagues and clients, and being prepared for meetings. That's how you are a professional. Acting responsibly at all times, behaving, this is how what's involved in being a professional. Behaving as a mature adult, using language that is culturally appropriate, age appropriate, understandable, and not offensive. Speaking honestly and with integrity, and knowing how to communicate information. Each setting has different expectations. Roles vary based on different ages and backgrounds of clients, system size, individuals, groups, families, and organizations, level of training or education. And all of these things are important. Practitioners with graduate degrees might have several roles. They may work independently in private practice, being a counselor or educator, being a supervisor, being a consultant, being a director. And that's why he has so many arms. I write a lot of letters of recommendation for my students, my former students. Um, Many of them are going to graduate school, and there are a lot of different directions you can go with a bachelor's degree in psychology. Um, a fairly large number of my students are going into social work. They're getting their master's in social work. Others are doing, I have several students that are doing VA counseling, especially some of our veterans are going into VA counseling. A lot of different things that you can do with a bachelor's degree out there. One task that practitioners with graduate degrees may be asked to do is act as a mediator. A mediator provides an impartial forum for disputing parties to discuss areas of disagreement or misunderstanding. In most states, if you have a degree in counseling, a master's degree in counseling, then you can get a license of some level at some level. It's not everywhere, however. In some states, you have to have a doctorate in order to do counseling. So you need to be aware if you want to move to California. California is one of those states where you have to have an advanced degree, a PhD, or a doctor of psychology, what they call a Psych D. New York is another one, is another state. So the more populous states, they require doctorates in order to do counseling. Some states don't even require master's degrees. Montana, for example, Wyoming, for example. Generalists maintain expertise in a broad range of functions: case management, coordination and monitoring of services, broker, linking clients with services and resources, advocate, working to support a client. And of course, if you are working as a social worker or you're working as a counselor, one of the things that you need to do is make sure that your client is taken care of. And the best way to do that is to be aware of all the services and resources that they can use to help them survive. Being professional goes beyond what you do in your interactions with colleagues and clients. Being aware of the social, political, economic, and cultural factors that impact individuals, families, groups, and institutions, and advocating for their betterment. And of course, that is one of your jobs as well, is the fact that you need to advocate for your clients. As an instructor at Dene College, my job is to be an advocate for my students. And so I attempt to do that whenever I am asked. Developing a professional identity involves knowing what it means to be a practitioner of your particular discipline. Scope of practice involves knowing what activities, knowledge, and skills identified by licensing boards and professional organizations relate to your discipline. One of the things that has happened to me lately is that I've been named as the chair of the psychology department. Many of you were admitted into the psychology BA program under my endorsement. I will continue to do that, and if you have any other problems with anything that deals with the psychology department, I guess that it starts with me, and it actually starts with your instructor. And if, of course, if I'm your instructor, that it starts with me. And then it goes to our school dean, which at present, it's Patrick Blackwater is the dean of the School of Business and Social Sciences, and the provost. And currently the provost is Alyssa Landry. So if you have a complaint or a suggestion, send it to me. You can ask me anything. My door would be open, except it's 1,500 miles away from where you guys are. Anyway, yeah, just drop me an email. Tell me whatever you need, what you'd like taken care of. Sometimes organizations will employ groups of professionals that they will organize into working teams. Each member will bring their own professionalism, culture, education, and individual ways of dealing with clients. Working productively with interdisciplinary teams is an important aspect of being a professional. This may mean that the practitioner must learn the language of another profession. Every professional must respect the expertise of their professional colleagues, which isn't always easy. One of the things that seems to be happening in academia these days is specialization. So if you want to be you want to be a psychologist, and you go to certain schools, you have to be a cognitive psychologist. They don't teach you to be anything else, so you specialize. I have a colleague, a former student, who is a IO psychologist, and he's looking for a job right now. So if you need an IO psychologist, he's your man. Anyway, he's looking for a job, and since he specializes, I told him you need to be as much of a generalist as you possibly can, but education doesn't work that way as much as it used to anyway. So he took classes that outside of the IO industrial organizational framework, and because of that, those are the classes he's teaching right now. He's teaching a general psychology curriculum. Um, like I said, a lot of people, they don't want to do that. They just want to do one thing, and they kind of get stuck because, well, anyway, I'm a generalist. Dr. Barber is pretty much a generalist. Dr. Begay is a counseling psychologist, and Dr. Russ is an educational psychologist. The practitioner working in a team must recognize that different professionals may work toward the same goal using different methods. Even in the same profession, practitioners may use different approaches, and of course this is sometimes a problem. When I first started at Diné College, the person that put together the program was a cognitive psychologist, and her direction and her impetus and her emphasis was on research psychology. She wanted everybody to become a research psychologist because that's the direction that cognitive psychologists take. Well, I'm a generalist, and I knew that from my experience working on the Fort Belknap Reservation up in Montana, that what primarily is needed is counseling psychologists, and but I couldn't convince her because, as far as she was concerned, research was the only direction for a psychologist to take. So in order it took a couple of years to liberalize the program. It took her loosening the reins a little bit before we were able to get to start moving in that direction. And now, of course, we have several different counseling classes. We're looking to add a substance abuse counseling certificate to the program. So you can be a research psychologist, you can be a counseling psychologist, you can be a generalist if you like, if you want to go in that direction, or you can become, in the future, of course, we haven't added those classes yet, but you can become a substance abuse counselor. Dr. Barber his expertise are in forensic psychology, which is always kind of interesting. And he's going to add that class in the future. it took some some doing. I thought she was going to fire me those first couple of years when I was trying to tell her that she needed to add a couple of classes that would help people get into something other than research psychology. She was not real happy about that, but we everybody survived, and now the program is is a lot more liberal than it was in the past. Your supervisor will help evaluate your level of competency by providing feedback about your use of skills, inviting you to engage in self reflection. Consultation involves meeting with an expert who can help you solve a particular dilemma or problem. Sometimes your client's problem may be beyond you or your team's ability to handle. At that point, a consultant must be called in to help because they have the expertise to deal with that. Now, that doesn't always work. We were living in Omaha, Nebraska. Actually, we're living in Plattsmouth, but Omaha is just north of I'm sorry, Omaha is just north of Plattsmouth. And there was a high school there, and they had a cluster of suicides. The interesting thing about the high school was that it was a Catholic high school, and of course, Catholics aren't supposed to commit suicide. They can't be buried in hallowed ground if they do that. But here we had this cluster of suicides at a high school, and we lost 5 students out of that high school, and there were like 17 attempts. People got people were real upset about it, and so they called in a consultant, and the APA sent a group of psychologists. But unfortunately, the group of psychologists they sent were from New York City. And of course, if you know anything about Omaha, Nebraska, it's kind of a farming town, and they were sending them to a Catholic high school. I don't know what they were thinking when they sent the people in there, but they were these Jewish guys from New York that had never dealt with. They'd never been out of the city, and here you are. You know, you go from cement and high rise buildings to Omaha, and the highest building in Omaha is probably 10 or 15 stories. Real interesting. And of course, they're trying to do counseling, and they're experts on suicide. The problem was that they didn't know how to talk to farm kids, Catholic farm kids from Nebraska. And wow, I'll tell you what, it was kind of interesting. And it actually stopped the suicides because the community came together and convinced the APA to pull those guys because they were causing so much trouble. But in a strange way, in an odd way, they stopped the cluster of suicides by being so obnoxious that nobody could deal with them. Nobody wanted to deal with them. It was really kind of strange. They didn't understand the culture. They were experts in the field, but they just could not communicate with the people from Omaha. The farm, especially the farm kids from Omaha. Most professions set ethical guidelines for remaining current with best practices, continuing education, evaluating your work, continuing education, and ethical standards every year. While the practitioner is responsible for structuring the relationship with the client, success can only be reached if the relationship is collaborative, goal-directed, purposeful, and time-limited. Now, when I talk about Omaha, Nebraska, I don't want you to think that Omaha is this redneck place full of a bunch of toothless farm kids. That's not it at all. Actually, Omaha, just south of Omaha is Bellevue, Nebraska, and Bellevue is where Offutt Air Force Base is. So it's a fairly cosmopolitan's not really the right word, but it's a very diversified environment with a lot of military people, and because of that, of course, they're used to just about anything except people that have never seen have never seen a tractor. That was the weird part. They sent all these guys in from who do their counseling on the 57th floor of the Chrysler building or whatever. It just didn't fit. A relationship between a client and practitioner is a fiduciary relationship. Fiduciary means trust. The client has confidence and trust. That's what fiduciary means in a practitioner's competency. Unequal with practitioner having more power than the client. That's the unique nature of the professional relationship. But with power comes a responsibility to help the client in the manner prescribed initially by the practitioner. That is the end of that. We're going to talk about counseling online. I put this together a couple of years ago. This is before COVID. I probably should update it. Or I think maybe I updated it last year. There's new statistics coming out dealing with online counseling, telemedicine, whatnot. Telepsychology. Psychologists commonly refer to any therapy delivered by telecommunication tools or devices as telepsychology. You may hear it called web therapy, phone therapy, text therapy, or online therapy. Anytime you're interacting with a psychologist using a website, a phone, or a mobile app, you could be taking part in telepsychology services. It works. I know that it works because I had a colleague who decided they wanted to get a counseling degree. And so they found themselves a nice big scholarship and they started taking classes. And the first class they took was a counseling class. And they discovered that they had problems. And this is one of the things that you need to think about. If you've got a problem that you've never dealt with, and a lot of times these are problems that you may have had from a childhood trauma or some other problem that has happened to you in your time that you partially dealt with or didn't deal with at all. What will happen if you try to become a counselor is that if you confront a client with the same problem that you had, and you haven't actually dealt with that problem, what will happen is you will start treating yourself through them. And it taints the way that you see the problem and the way that you deal with the problem. And that's exactly what happened to her. She discovered that she had been married 3 times, and she discovered the fact that she hadn't dealt with the problems that she had when she was a teenager, and she hadn't dealt with the abuse that she had incurred from one of her spouses, one of her ex-spouses, and she had to go into therapy. And of course, they kept her in the program. They tried to keep her in the program. They kept delaying her entry into the program. And they started the counseling, and they discovered that she had, well, at first the problem seemed to be the fact that she hadn't dealt with the abuse of her ex-husband. And then she discovered that she had problems that went all the way back into her childhood. And of course, she decided not to become a counselor because she was in therapy. She was in therapy for like 18 months. And therapy was free because she had all the scholarship money. And it was through the institution where she was going. And anyway, for 18 months, she was, anytime she had any kind of a crisis, she called her therapist on the telephone, and they would or they would email back and forth. And that's the way it worked. And it worked very well. I don't think she dealt with all of her problems, but she dealt with a number of her problems. In her case, what happened was that dealing with this led to her discovering this, and then dealing with that led to another problem. Okay, and that was her. That's why it took 18 months of therapy, as weird as that is. Anyway, old story, and a long, long time ago, in a land far, far away. Technology can contribute to an evolution in how people receive psychotherapy, and that is a warning to people. If you've got a problem that you haven't dealt with, then becoming a counselor, you're going to have to deal with your problem before you can do any counseling, because what will happen is you will start treating your client from your perspective. And since you have never dealt with that problem, your perspective is skewed. Okay, so unless you have dealt with it and understand it and recognize it, then you're going to have troubles dealing with your client's problem. Technology can contribute to an evolution in how people receive psychotherapy or work with a psychologist. Researchers are taking great interest in telepsychology and telehealth, evaluating how well it works, especially compared to in-person, in-office psychotherapy sessions. And I will show you some research that has been done in this area at the end of the presentation. But much like the technology, the research is still new, and there is a lot science doesn't yet know. And of course, it was not as frequently used before the pandemic, and now that we've been through the pandemic and we're on the other side of it, we know a lot more about telepsychology than we ever have before, and we know how well it works. There are a few points to consider before signing up, and actually it's the same way with education. We weren't exactly sure about this online stuff. It seemed like I don't know if you can really teach online because it's not traditional, that kind of thing. Not traditional, they don't do it in England. If they don't do it in England, how can we do it in the United States? That kind of crap. Anyway, so yeah, now that we've been through the pandemic and we had all these kids that had to go to virtual school, now we know a lot more about it, and actually it's growing by leaps and bounds. I don't remember any Zoom classes prior to the pandemic. I had never taught Zoom, and I'm still not teaching Zoom. I think this works fairly well. Some people have a difficult time with it because they're not used to it. But my plan is to continue online until they tell me I can't do it anymore. I don't think my situation is really kind of strange. I'm 74. My wife's 72. She she has some infirmities that make it difficult for her to live alone. And I'm up in Iowa, in a cornfield in Iowa. Anyway, I don't think I can come back. I don't think my wife could survive, especially in the winter. My goodness. We just had a snowstorm a couple weeks ago, and I don't know if she would have survived the snowstorm. And I know if the electricity goes off, I don't know what she would do if I weren't here. Anyway, my daughter is in the area, but so it's a 2-day trip. Even if I fly, it usually takes a day to fly and a day to drive from Albuquerque. 3 or 4 hours to drive from Albuquerque to Saline. So I'm a couple days away, no matter how I try to travel. Why am I talking about this? Oh, we're talking about telepsychology and how things change in time. When you're forced to change things, then you can change very rapidly because uh, if you're thinking in a specific way, like you can only teach classes in the classroom, and I have to see my students, that kind of thing, then you're never going to try to look at it from a different perspective. But since we had to during the pandemic, I was already teaching online. I've been teaching online since the 90s. Internet only started in 1993, but I was teaching on a military base, and the military's had military's had a form of the internet for a long, long time. As a matter of fact, GPS, which I'm sure you love it because you can plug any address anywhere and figure out how to get there. GPS was a targeting system developed by the Air Force. So I mean that's been around for probably 60 years. Anyway, why am I talking about these things? There are a few points to consider before signing up for any services that are offered exclusively online or by telephone. It can be convenient. Online therapy can take less time away from the office or your workday or worry about traffic. And that's, of course, not as much of a problem in, say, Lee or Chinle as it would be in Phoenix or Flagstaff or Tucson or Albuquerque. No need to travel miles to meet up with your psychologist, of course. Dial a number or log into a site, and the session can happen wherever you are comfortable. And of course, being comfortable is really important. The other problem we have, and we used to talk about this when we were talking about only face-to-face counseling. A lot of times your clients will get all dressed up and all dolled up to come in to talk to you. And when they have on different clothes, they don't have the same problems as they would have if they were dressed in their bunny slippers and sitting in their pajamas in their living room on their couch. You are more likely to get good information from them if they are in their dressed in their vulnerable clothes. Isn't that weird? Dial a number. Okay, we've already done that. Let's go ahead. Compared to traditional in-person therapy, it can sometimes appear less expensive. Some apps will advertise pricing that provides unlimited use for a weekly or monthly fee, or the online session may seem significantly lower than in-office visits. And of course, not spending the money on gasoline is important as well. If you're not interested in using health insurance for psychotherapy, this can be a benefit. And of course, this is all written by a white guy, so money's real important. Online communication is very comfortable for many people, especially younger adults or those who use technology often. More people are using email, webinars, and text messaging to communicate, and it can seem more comfortable or easier than talking to someone in person, especially when revealing personal or private information. And of course, this may be the direction of the future because kids are more used to, I call them kids, individuals are more used to being online than they are to talking to people face to face. I have been I've been teaching for a while. When I was teaching at Ashford, I can remember leaving the classroom and got all these students moving back and forth. Nobody's looking or talking to anybody. There's no noise, and what the reason is because everybody's checking their cell phones. I was at the gym the other day. I may have already told you this story. I was at the gym the other day, and I'm lifting weights, and there's 5 of us in the gym, in the weight room, and I'm lifting, and I don't take my phone into the weight room. But the other four guys were there, and they were all on their phones at the same time. It was just so weird. They were on their phones more than they were lifting. And I lift a little bit differently than most people do. I lift anaerobically, which is an interesting way of doing things, so I sweat a lot. Not that the sweating is as important as the fact that these guys spent so much more time on their phones than they did lifting weights. It just seems so silly. And so here I am, I'm lifting my weights and I'm looking in the mirror, of course, which is something you do at the gym. And I can see all four of these guys, and they're all sitting on equipment, playing with their phones. I don't know what they were doing. Maybe they were changing the song that they were listening to. I don't know. Yeah, as weird as that is. It can provide access to those who can't get to an office. In some rural communities, the nearest psychologist office may be an hour or two drive away. Some people with chronic illnesses or disabilities may not be able to drive or be easily able to leave their home. In these situations, web or telephone-based therapy may be their only option for help. The research hasn't yet shown that standalone therapy online or via texting is effective for everyone in every situation. Some sites advertise that they offer therapy, but those claims may be misleading or false. For example, the people behind the apps may not be licensed or qualified to provide therapy, and the reality is that each state licenses and dictates who people can counsel or who they will allow to be counselors. There's a lot of money in counseling, and for that reason, states try to control it. Licenses are granted by each state with their own laws and rules, much like each state determines what residents must know to earn a driver's license. But unlike driver's licenses, which allow you to legally operate a car in all states, a healthcare provider is limited to providing services in the state in which they are licensed only. The provider must be licensed in the jurisdiction where they are located, and making that determination may be difficult to do if you don't know where he or she is physically located. Psychotherapy works in part because psychologists ensure that clients have a safe, private space to share deeply personal and sometimes difficult stories, thoughts, or emotions. What happens and is said in a therapy office stays there with the exception of a few situations. The site or app you use should, at a minimum, be HIPAA compliant and have the ability to verify your identity and your therapist's identity. Many insurance companies cover the treatment of mental health and substance abuse disorders, but online therapy or web therapy services are often not covered or reimbursable by most insurance providers. Okay, so now we're going to talk about some of the research that we have done or has been done on comparing face-to-face with internet-based intervention groups. A total of 62 participants suffering from depression were randomly assigned to the therapist-supported internet-based intervention group. That's 32 people, and to the face-to-face intervention. That's another 30 people. And if I'm not mistaken, this is exactly 62 people. The 8-week interventions were based on cognitive behavioral therapy principles. That's why I put it up there, not because all these little girls have problems, but because there's actually 62 people there. So there were 32 in the internet-based intervention group, and there were 30 in the face-to-face intervention group. The intention to treat analysis yielded no significant between-group differences, online versus face-to-face group, for any of the pre to post-treatment measurements. At post-treatment, both treatment conditions revealed significant symptom changes compared to before the intervention. Okay, this is a second one, a second research. A total of 113 consecutive patients were randomly assigned to 10 weeks of either guided internet-delivered cognitive behavioral therapy, there were 53, or group cognitive behavioral therapy. There were 60 in that group. After treatment and at a 6-month follow-up, patients were again assessed by the psychiatrist, blind to treatment condition. They found no statistically significant differences between the two treatment conditions using a mixed models approach to account for missing data. Group cognitive behavioral therapy utilized considerably more therapist time than did internet cognitive behavioral therapy. Two new studies suggest online therapy may be effective for treating mental health issues. Online therapy is increasingly popular, particularly among people who live in rural areas and cannot easily get to a therapist's office or who are concerned about the costs of in-person therapy. New technology may pose some concerns about the security of online therapy, continues to be an issue, but research suggests the benefits may be significant. The first study published in the Canadian Medical Association Journal reviewed studies of online cognitive behavioral therapy conducted between 2000 and 2012. Cognitive behavioral therapy is a widely used and well-researched form of therapy, with most studies saying in-person forms of this treatment are highly effective. Cognitive behavioral therapy focuses on reducing negative thoughts, thereby changing behavior and alleviating symptoms. Most of the studies tracked participants for a relatively short period of time after undergoing therapy, ranging from 8 weeks to about 2 years. Researchers found online cognitive behavioral therapy could effectively reduce symptoms of depression and other mental health issues. In some cases, online cognitive behavioral therapy was even more effective than traditional in-person therapy. Most online cognitive behavioral therapy sessions focused on short-term goals and symptom relief. Because the studies did not track participants for an extended period of time, the researchers do not know if the symptoms were permanently alleviated. The team that conducted the analysis cautions that some human connection is lost with online therapy, but they also say that the evidence supporting online therapy's effectiveness is significant. Another study published in the Journal of the American Medical Association Psychiatry looked at how online therapy affects the well-being of new doctors. Young doctors often work long hours, including nights and weekends, and the stress of these long shifts can lead to mental health issues such as depression and suicidal thoughts. One previous study found that suicidal thoughts increased fourfold during a medical residency. Researchers looked at 200 first-year medical residents working 80-hour weeks and overnight shifts. Compared to doctors who received no online therapy, doctors who received 4 30-minute online sessions before beginning their residency had fewer suicidal thoughts. Because the sessions were delivered online, researchers say it might be possible to provide such treatment to other doctors while still keeping costs low. This is a research from Gupta, Goel, and Raymond in 2022. The efficacy of online mental health program IMOAID during the COVID-19 pandemic. This is from the Journal of Mental Health and Human Behavior. Just like everyone else worldwide, the lockdown due to the COVID-19 pandemic caught the mental health providers in New Delhi, India, flat-footed. Just like number 58. Wait a minute, we'll see it again. Watch, he's flat-footed. Oh, got him. China, Spain, and the United States, Turkey, Italy, Iran, Nepal, and Denmark reported mental health levels as high as anxiety 58%, depression 48%, PTSD 53%, distress 38%, and stress 82%. This opened the door for a new online program called IMOAID. IMOAID. And that's why I have her. She's an emo. Emo, yeah. That's what they call Weiner and colleagues developed an online cognitive behavioral therapy CBT program, My Health 2. The Center for Child and Adolescent Wellbeing started an online program called EmoAid to address the psychological issues in the community. EmoAid is a flagship online experimental learning program of the CCAW, Center for Child and Adolescent Wellbeing. EmoAid is a program targeted at individuals to help them understand and resolve emotional issues by teaching them various techniques, for example, neuro-linguistic programming, eye movement desensitization, reprocessing, acceptance therapy, narrative therapy, and yoga. Now remember, this is in India, which can be used during distress hours. Gupta et al. In 2022 measured the efficacy of the new technique by recruiting 146 participants between the ages of 15 to 72 in a pre-test, post-test, and 3 weeks post-test mental health measurement after 5 sessions of EmoAid. The results of the study highlight the efficacy of the program, EmoAid, as the mean values of depression, anxiety, and stress symptoms reduced significantly. The program was found to ease the distress for a considerate time, as maintenance effect post 3 weeks of the program was also observed. Okay, Erardi, Bottini, and Riva Krugnola. And this is another research from 2022. Effectiveness of an online versus face-to-face psychodynamic counseling intervention for university students before and during COVID-19 period. From the British Medical Center Psychology. The COVID-19 pandemic has increased online counseling interventions, including those aimed at university students. And this is in England, remember. The other one was in India. The principal aim of the study was to evaluate the effectiveness of the online counseling intervention during the COVID-19 pandemic, comparing it to the effectiveness of face-to-face intervention. 34 students with a mean age of 23.74, 27 of them were female, who requested online university counseling during COVID-19 were compared with 81, mean age 22.8, with 60 of them female, students who requested university face-to-face counseling before the pandemic. The psychopathological problems were assessed with the symptom checklist 90 revised, attachment styles with the attachment style questionnaire, adverse childhood experiences with adverse childhood experiences questionnaire, and life satisfaction with the life satisfaction scale. At the pre-intervention phase, psychological distress was similar in both groups with no differences in the general severity index, and there were no significant differences for secure-insecure attachment, adverse childhood experiences, and life satisfaction. The online counseling intervention during the pandemic was effective in reducing psychological distress scales as depression, obsessive-compulsive, interpersonal sensitivity, and anxiety. The face-to-face counseling intervention was effective in reducing psychological distress in all subscales and in increasing the level of life satisfaction. Attachment style did not moderate the effectiveness of online and face-to-face interventions. And that is the end. So as you can see, studies since before COVID-19 and since COVID-19 have shown that online counseling is just as efficacious as face-to-face. It seems to be that way. So it works. That's why I'm going to teach you how to use it. You can still do face-to-face if you are close enough to somebody and you want to do a face-to-face counseling session. I have no problem with that. Your counseling sessions are going to be between 35 and 45 minutes long. You'll need to do 10 of them. We're going to start in April, I think. Yeah, we're going to start in April. So you'll have By that time, we'll be all done with a coursework. So that will be your task from April through the end of the semester, beginning in April, beginning on April 1st, if I'm not mistaken, after the 8th week. And that's one of the reasons why we're running through these chapters so rapidly. It's a fairly small book. If you have a copy of the book, you can, it's only what, 150, 200 pages long. Fairly short book. I think it's a really good book. I've taught out of this a similar book before. I was teaching counseling at Fort Belknap, and I was preparing some of my students to go to get a bachelor's degree in social work at Salish Kootenai College. Fort Belknap is a 2-year institution, and I was preparing students through a program called MHCOP, Mental Health Career Opportunity Program, out of University of Montana. Anyway, it worked. I have lots of students who are counselors out there. So there you go. I'll talk to you next week.